Hey, good afternoon. This is State Rep Bud Williams from the 11th Hamden District in Springfield, Massachusetts. And I have the pleasure of being one of the co-hosts. And first of all, I want to thank the men of MOCHA, Greater Springfield, and for AdMeTech Foundation for helping us to get information out to the broader community. This goal is to empower people of Springfield, representing one of the top hotspots of the pandemic in the state, to protect their families and communities, reduce spread of the pandemic, and take charge of other health conditions in the face of this pandemic. Because we also realize there are other issues, high blood pressure, hypertension, cholesterol, sugar diabetes, other indicators. So with that being said, I know we're a little bit behind. I'm going to first of all turn it over to my dear friend, the chairman and the president of the Black and Latino Caucus, Carlos Gonzalez, and he's doing an outstanding job in terms of showing tremendous leadership in this very, very difficult time of racial tension in the Commonwealth in this country. But he's been fantastic. That's my brother, and at this time, Representative Carlos Gonzalez.
Thank you, Representative. Thank you, Representative Williams, and thank you all for being on this town hall. I apologize. I went out and all of a sudden my dog started barking when I'm outside. He'll be quiet in 1 second. So I want to just thank you all for the work that you do on behalf of our residents of Springfield, and particularly in these difficult times as the pandemic continues to run ravage around our communities of color. And it just highlights the health disparities that continue to exist in our communities of color. One of the issues that at the State House that we're addressing with my colleague, Representative Williams, is to bring about some of the concerns that you guys have addressed to us regarding the prostate cancer and how it impacts our communities. You guys have been doing an outstanding job in reaching out to our communities, particularly our Black men and our Latino men throughout Springfield, Massachusetts, but throughout the state of Massachusetts. AdMeTech has done a continuously great job in getting the information out, but also advocating for the solutions, because it's not only pointing out the problems, it's advocating for the solutions that are important to our communities. One thing that the pandemic has helped folks better understand is that no matter what demographic background you come from, or no matter what social economic background you live in, we are all interconnected. My health is connected to the essential workers' health. So if somebody that works in a supermarket that may be working for minimum wage doesn't have access to health care, his or her health has a direct impact on my health, because they're serving in the day-to-day operations of community living. So that's the critical important. No different when it comes to prostate cancer. If we don't address this at the forefront, we're going to have to expend a lot of money in the long run. So prevention is key. You guys have been doing a great job in reaching out, letting community know about how to get testing, how to get free testing, as well as the information that is available to support individuals that may be encountering this difficult situation during and after the pandemic. So we're excited to be working with you. We'll continue the effort and the State House with these challenging times of budget that we are going to be working on now. Budget season is here, difficult times, but it's the issues and the advocacy of individuals like yourself that will make it hopeful and helpful for us with Representative Williams to be fighting the battle to make sure that prevention in prostate cancer continues to be at the forefront of the budgetary discussions. Thank you for the opportunity to reach out to the community, and thank you for the work that you do.
Thank you, Representative, for those very kind words, and we still want to give you good kudos because you are showing tremendous leadership, and I really mean that. So thank you, and we'll continue to work together side by side as we always do. Moving on to the program, no one who really needs no introduction, Director of Health and Human Services for the City of Springfield, my dear friend, my childhood friend, and I want to say that she's doing a very outstanding job in the city of Springfield. Our numbers and cases continue to go on the downward spiral, which is very, very important in terms of the pandemic. So without any further, Director of Health and Human Services, Helen Carlton Harris.
Well, good afternoon, and thank you so much to all of you. First of all, let me thank the men of MOCHA who do an outstanding job reaching out to the community and assuring that there are intervention and prevention strategies in place for Black and brown men in our community. Thank you to Bud L. Williams, state representative, who is a mate of mine in terms of just the part of the city that we come from. Also, State Representative Gonzalez. So thank you to State Representative Williams, State Representative Gonzalez. Thank you so much always for your leadership. We are absolutely blessed in the city of Springfield to have Representative Gonzalez as well as Representative Williams with us to advocate for us in the State House. They are absolutely amazing. I have with me Tony Petaway because I always need technical assistance when I'm doing Zoom. So I'm grateful that he is here to help me. I also am grateful that we are discussing one of the two pandemics in this country right now. Obviously, COVID-19 is one. The second one is racism. I look forward to the Zoom call that the MOCHA men and the state reps host so we can have that very important discussion as well. Here in the city of Springfield, we obviously, like the rest of the Commonwealth, are extremely pleased that we're seeing the numbers go down as far as COVID-19 is concerned. That happened with a lot of work, a lot of sacrifice, and a lot of commitment with the residents of the city of Springfield, as well as across the Commonwealth. And so we're looking at numbers right now, as far as our cases are concerned, in the single digit. I'm going to put up the slide that is the number of cases that we're dealing with as far as the COVID-19 is concerned. I'm sorry, this is going to, hopefully we're doing screen sharing. Tony, let's come out of that and go to the bar with the cases first, please. Thank you so much. So we're going to go to our caseload in the city of Springfield. Currently, we have 2,553 cases in our city. I'm showing you a bar graph that is showing you where we began, the 3, 4, and 2 cases, and 17. So if you look at our timeline, you certainly can see that as a city, we have had multiple numbers, some of them as high as 104, then some of them as low as 2 or 3 in the beginning of the pandemic. If you look at the bar graph, you can see that we are once again flattening the curve. Our numbers are going down. And again, that is due to the work of many individuals in our city. And this graph is up every single day. And so we're able to show our residents where we are. We continue to ask our residents to stay vigilant in the city, and they are absolutely doing that. And I am, again, extremely grateful. The next graph I'm going to show you is the map of where we have mapped the cases in the city of Springfield. And when we start to talk about our Black and brown communities in the city of Springfield, I know that state rep, both of our state reps will recognize these parts of our city. And so where we have density in the city, those zip codes, 01104, 01105, which is the south end, 01107, which is the north end, the Mason Square area, which is 01109. And also we see clusters in Indian Orchard. 01107 as well. So that all of those dots you see that are on that perimeter really are the areas in the city where there is a lot of density. And we also know that if we overlay every health status indice that we have in the city in those particular zip codes, 01103, 01104, 01105, 01107, 01109, and also the cluster in Indian Orchard, which is 01151. The demographics in those cities, in those communities, in those neighborhoods, definitely represent the Black and Brown communities in our city. So we know that the community spread and the highest caseloads are found in those neighborhoods. Again, if we overlay any health status indice that we have in the city of Springfield in those neighborhoods, you will see the higher rates of diabetes. You will see the higher rates of cardiovascular disease. And so we know particularly that this COVID-19 really has unmasked many of the disparities that we already knew existed in the city of Springfield, but it has shined a light on just where it is in the city. And again, I can overlay most health status indices, and our communities of color will be disproportionately represented in each and every one of them. These dots do not represent particularly, we have not put streets in them, although I do have one with streets. We wanted to make sure, to the degree we could, we were making sure that we were protecting the privacy of individuals. I've already had people try to overlay the map with streets, and while it's important to know some data, we really wanted to show where the prevalence was in the city. Also, the number of locations in the city where we're seeing the virus is also very important, I think, as well. And right now, this map is as of June 14th, we had 1,515 locations in the city where we have COVID-19 positive. Now, you all know that there's often more than one individual in a household, and also our long-term care facilities are represented in some of those neighborhoods, which we also know we are seeing higher rates of death as well as higher rates of infection. Community spread is alive and well, and I am hopeful that our residents are paying attention, and I know that they do. I'm so proud of the individuals in the city of Springfield and really how they have responded to our request to do something they've never had to do. Socially distance, wear a face mask, consistent hand washing, and all that goes, staying home if you're sick. We all know what the non-pharmaceutical interventions are. The last bar graph I'm going to show you is the deaths in the city of Springfield. And so we have had in our city since the beginning of the pandemic and through this map, these bar graphs are through June 6th. And so there's the potential, obviously, that we have had more deaths since June 6th, and we will be updating this. Important, the age 40 to 49, there were 4 deaths, 50 to 59, 7. 60 to 69, 20, and 70 to 79, 32, as well as 80 to 89, 32 as well. And then 90 to 99, we've had 20. And so that represents the 115 deaths that we have had in the city. Let me break down for you very quickly the race of those deaths. So 55 are white, which represents 47.82%. 32 are Hispanic, which represents 27.82%. And then 26 are Black, which represents 22.60%. And we've had 2 Asian individuals who passed away from COVID-19, which is 1.73%. The numbers that are not on the previous bar graph that I showed you on Tuesday, there were 2. and on Wednesday there were 7. And so again, everyone is doing amazing work across the Commonwealth, and we in the city of Springfield continue to keep the data in a way that hopefully it informs the residents. There certainly are other bar graphs and other data that I have, but I wanted to be respectful of my time here and just show you a snapshot of where we are. We again, health disparities, underlying conditions. We know that Black and Brown people are mainly and mostly represented in the city of Springfield. This is not a reflection of genetics. The number one health status indices that I talk about consistently is poverty, making sure individuals have a living wage, making sure individuals feel comfortable in our healthcare system and are able to access healthcare that is culturally and language specific and that values the individual in a way that makes them want to have their health be taken care of by our healthcare system. Navigating our systems for many of our residents is a challenge. I will give you one last data point, and in our city, we had 187 homeless individuals tested. The city of Springfield paid almost $400,000 to put up a structure to take care of our homeless individuals. There were 3 parts to it: a testing tent, a PUI tent, as well as a COVID-19 tent. At the time we structured that facility, which is state of the art and has airflow, has hand washing sinks, has washer and dryers, heat, and also air conditioning, we really built something that we wanted to make sure that we were taking care of the most vulnerable of our populations. And so at this point, the tent has been shuttered. And you may ask why. In the city of Springfield, we tested approximately 187 individuals. We only had, and I say only because I've looked at the numbers, obviously from Boston and from Worcester. We tested 187 individuals. We had about 11 individuals that were COVID positive from our homeless population. That's about 6%. And so we did not, fortunately, and we are absolutely so pleased and so amazed that we did not have the kind of outcomes other cities and towns have had. And so I will end there and thank my state reps, Carlos Gonzalez, who I worked with for many, many years, and Bud L. Williams. We live on the same street. And so when he's not doing his job, I am there to make sure that I can walk down to his house and say, "Are you home?" He never is, by the way. He's always at the State House. And so thank you both. And the men of MOCHA, we miss you, care for you, and glad that you are doing well. Thank you.
Boy, thank you, Commissioner, for that outstanding presentation in terms of giving us the data. And we always talk about information being power. And when folks have information, they'll better able to deal with life problems. So thank you again, Commissioner. I know you're very busy. I know you have to go. So please, you're still on the front line. Well, thank you. Thank you again. And thank you, Mr. Petaway. Thank you, too.
Petaway.
Thank you, Mr. Petaway.
Thank you.
At this time, we're gonna keep moving, and the individual really needs no introduction, and that is Dr. Stern, MD, President and CEO of AdMeTech Foundation, and she's one of the first people I met when I got to the State House, and their work is phenomenal. And every year, the legislature, House and Senate, and the governor make sure we try to fund her particular program because they do tremendous work in terms of health disparities with Black and Brown people. And people, poor people, and people in the gateway city, not just Springfield. And you got Brockton, you got Holyoke, you got Lawrence, you got Lowell, you got Lynn, you got Chicopee. Those are all gateway cities. So, Dr. Stern, you really need no introduction, but it's my privilege and pleasure to introduce you. And It's on you, Dr. Stern.
Representative Williams, thank you for the opportunity to take part in this event. I will provide a medical perspective on COVID-19 pandemic, emerging advances in prevention, diagnosis, and treatment. I'll focus on what we can do today, what we can expect within a few months, and until late 2021. I will also address why chronic, life-threatening, and emergency conditions cannot wait in the times of coronavirus. The main challenge of this pandemic is asymptomatic infections. It can be anyone, including us. What can we do today to protect ourselves, our families, our communities? Social distancing and mask face covering is a state mandate and CDC guideline. As someone pointed out, your mask protects me. My mask protects you. Protection of our hands through hygiene or gloves in public places. Protection of our eyes through glasses, basic goggles. If we follow these very simple guidelines, together we will be able to decrease the spread of the virus drastically. If you are at higher risk of severe disease, talk to your doctor and learn about support and resources available in your community. High-risk individuals include senior citizens, young children, 12 months and younger, patients with underlying health condition, including impairment of immunity, for example, cancer treatment or immune disorders, lung, heart, liver, kidney diseases, diabetes, obesity. Disadvantaged communities, particularly minorities, struggling with low income, poverty, homelessness, pregnant women. If you have flu-like symptoms, if you were exposed to someone who is sick with COVID-19, you can assume you may have this disease and isolate yourself to protect people around you. Call your doctor. Utilize state resources. There is a lot of valuable, extensive information available about this pandemic online at mass.gov. You can also call or text if you have questions or need help. If you develop difficulties breathing, please call emergency services. COVID-19 diagnostics are critical for early detection, controlling pandemic, and safe return to work. Currently, we have two types of testing: for live virus or active infection, and its antibody or immune protection. Detection of active infection is widely available today for individuals who have had symptoms or contacts with known COVID-19 cases. It's a molecular testing considered a gold standard. More recently, we've seen availability of antigen tests for viral proteins. It's very rapid and very similar to a flu test. When we go to any doctor's office and get result within less than an hour, very frequently within a few minutes. FDA issued emergency approval for this test on May 8th, largely for further clinical evaluation. We can detect antibodies against virus about 2-3 weeks after people get infected. Antibody test is fast, cost-effective, and simple. It's a blood test, though FDA and experts recommend more research on its accuracy. If antibody tests are proven to be accurate, leaders of diagnostic laboratories promised more than 150 million tests per month available by the end of this month. COVID treatment is likely to be developed and succeed in near term. Multiple organizations are working on treatment strategies and their evaluation. Detection of early disease is critical when mild to moderate symptoms reflect initial viral infection and initial inflammation. Over the last 5-6 weeks, we've seen preliminary results on several antiviral drugs that can stop virus replication, improve symptoms, and expedite recovery. The goal here is to create a Tamiflu equivalent for COVID-19. The next step is to have extensive conclusive global trials, which are currently underway. Scientists are working on selecting and cloning the most potent virus-neutralizing antibodies from the blood donated by COVID survivors. If these trials are successful, antibody treatment may become available later this year with broader availability next year. In Lancet on May 8 this year, we saw a promising article on a combination treatment integrating antiviral drugs and anti-inflammatory agent interferon. About 10-15% of patients with COVID, usually after the first week, progress to a severe disease. Treatment goal for severe disease is to decrease viral load and life-threatening inflammation, particularly in the lungs. On June 16, Oxford University announced the first life-saving drug. It is anti-inflammatory steroid dexamethasone, which is widely available, inexpensive, and can be readily implemented. On April 29, NIH reported that antiviral drug remdesivir, created by Gilead Sciences, expedited recovery of these patients by about 30%. The company donated treatment to over 120,000 patients in early May and promised sufficient doses to 1 to 2 million patients by late this year. Global clinical trials studying antiviral drugs with and without potent anti-inflammatory drugs for these patients are currently underway, and results are expected soon. The ultimate goal of any pandemic is to have publicly available vaccines. The key challenge right now is our uncertainty if antibody protection against the virus is strong enough or if it can last. And yet, most patients recover from COVID-19, creating hope that antibody can be actually effective against the virus. Currently, we have multiple vaccine candidates. The key challenges in making these vaccines publicly available is to show their safety and effectiveness for immune protection. However, clinical trials can last at least 12 to 18 months. There have been systematic, coordinated, concerted efforts to expedite clinical trials. The goal of US government is to vaccinate 300 million Americans by early January. To achieve this goal, they have selected and supported 5 top vaccine candidates. Global goal is to vaccinate billions of people, which will require extensive support from multiple pharmaceutical and biotech companies. While we are dealing with this pandemic, chronic, life-threatening, and emergency conditions cannot wait. Many people stop going to clinical facilities out of fear to contract coronavirus. And yet delays in care can result in reduced quality of life, if not loss of life. I would like to emphasize that clinical facilities created a safe environment for adults and children. For example, telehealth for chronic conditions and prevention, ongoing care for cancer and other life-threatening diseases, medical emergencies, heart attacks, strokes, appendicitis, etc. If I were to draw a parallel between our taking care of our health and our driving, I would like to leave you with several questions. Would you like to continue driving dangerously? Would you want to stop driving altogether? Or would you navigate your car wisely? Thank you for your attention.
Wow, Dr. Stern, absolutely fantastic. Oh, I've seen a lot of presentations on COVID, but that's one of the best I've seen. Very organized, and I will absolutely use most of the information. It's in a package where most folks can understand it, broken down. And the key to anything is, and people might keep saying, why do you keep repeating over and over again social distancing and wear your mask, wash your hands? Because it's important. Because we tend to forget. Fantastic, doctor. Thank you. Moving right along, we're going to go to Dr. Latham, who's the medical director of Dana-Farber Cancer Institute at St. Elizabeth's Medical Center, facility director for cancer care, and equality and assistant professor at the renowned medical Harvard Medical School. Dr. Latham is going to speak about COVID-19 health disparities and how to address them from a clinical perspective.
So good afternoon. I think I'm going to save you guys from slides for a minute. I want to actually going to have a conversation and talk a little bit about this from the point of view of practicing medical oncologists. So thank you very much, Representative Williams. I also want to say thank you very much, Representative Gonzalez. Of course, shout out to Madam MOCHA, Albert, and Lamont. As they know, and many of you might know, I grew up in Springfield. I grew up right in the Pine Point area. I went to classical high school, which is now condominiums. And more importantly, the reason that that's relevant to me is that health disparities and health equity and, treatment equity has been a really important part of what I do. I actually treat lung cancer patients specifically, but the things that I'm talking about today and the point that I want to make today is kind of tailing in on what Dr. Chatern was talking about, which is really, we have to not run away from our treatments that we need to get to. Our communities in particular, if you want to think a little bit about disparities in care, specifically, right? If you're thinking about cancer disparities, number one cancer killer in all communities generally tends to be cardiac, but number two in the United States tends to be cancer. And then if you disproportionately look at our communities of color, our Black and brown communities, then you're actually talking about an even higher burden. Specifically for patients and for folks who have their screening-based cancers, so breast cancer we know about. We talk a lot about prostate cancer, which is complicated, but that doesn't mean that we shouldn't talk about it. And lung cancer, which almost no one talks about, but there's definitely screening that's FDA approved for that. What COVID has done, and I'll tell you as we think about this, especially for our, specifically for our underserved communities, during the time that the COVID epidemic was high, all the institutions, we told everybody to stay home. Right? We wanted you, and people listened. But what we have found is, especially in our Black and brown communities, immigrant communities, and our elderly communities, that now that we're telling everybody to come back, and I'm going to tell you about why coming back is okay, following in what Dr. Chatern said, that's actually the community that's struggling even more so. Because folks are really afraid. They're afraid to come in. They're afraid to get their usual screening. They're afraid to actually follow through with the rest of their care. And this is going to widen an already present disparity, right? An already present gap. The other thing that's happened with COVID that has actually changed the way we deliver our medical care is telehealth. And so there's more and more of these remote visits, which for some patients is great. But unfortunately, and we're starting to see some of the data on this, again, for our Black and brown communities, for our poorer communities, this particular method doesn't always work for folks. It's a struggle, and I think many of us who are on Facebook Live, we talk about all of us struggling with technology. Now you're asking your grandma to struggle with technology or having folks struggle with their technology at home. It's very difficult, and there are visits that are not happening there. God forbid you're doing it through interpreter services as well. And so I think the impact of COVID-19 will be beyond what you already heard people talk about and what you've already heard as far as the direct impact from the commissioner on Springfield and other communities of color, the indirect impact, as you've heard Dr. Chatern talk about, and you're probably also going to hear Dr. Wesley talk a little bit about, but also on how we deliver care. And I think that, and as we kind of look at, cancer care in particular, and cancer in how we think about approaching screening for a community that has already been underserved, it's really important. So the areas that specifically I want to talk about, obviously, lung cancer screening is one thing I want to give a shout out for. Again, in our communities, there's a lot of tobacco exposure. There's a lung cancer screening program. All screening had been stopped in Massachusetts until the 1st of June. And now people people are able to come back and get into their screening programs. I would say the same thing for colon cancer screening, which is very well established, and again, disproportionate in our communities of color. And I think also those complicated conversations that the men and MOCHA have been trying to have about prostate cancer also should be happening again. And I think the idea, and it's hard, but the idea is to if your community physician has not reached out to you, you reach out to them, and to actually figure out if this can be an in-person visit or it has to be an outpatient visit or a telehealth visit. That's fine. But what we're finding is that we are way behind. There's going to be a backlog of all these cases. We're seeing this in our cancer center as we started to open up because of the physical distancing. All of the hospitals and all of the different facilities will no longer be operating at 100%. For example, at the Dana-Farber, they're telling us to get at 60, 65%. So what that means is when we're starting to schedule these scans, biopsies, and all these other things, there's less staff there. So we have to get ahead of it and try to schedule things a little bit further in the future, because I think what we're going to have is this really backlog of cases, and again, it's going to be a Black or brown communities that might suffer. I do want to talk a little bit about how the hospitals ironically, have been safer, I think, sometimes than going to the grocery store. I will tell you that specifically the changes that have been made in our institution, and have you heard, I'm actually, not only at the main Dana-Farber, because you might say, well, is that relevant to, a community hospital or even a large hospital like Bay State in Western Mass, but I also practice at St. Elizabeth's Medical Center, which is a smaller hospital. And I think what you're finding is through all of these facilities, we have the same thing, which is, there's a pre-screening process where you might get a phone call from your office that asks people about what are your symptoms. Please be as honest as you can. I think there's some folks sometimes who've been holding back on that, but the idea of that is to figure out if folks need a test before they can come in for a procedure. I said, so that's usually the first thing, is to reach out. That's a phone call. The second part of that is even when you come into the building, there's some screening that happens there, talking about not just travel, but again, symptoms. And then, usually people will get a mask. You have to wear a mask. And you've heard this before, but sometimes people push back, don't want to wear a mask. It makes me feel uncomfortable. It makes my nose runny. But as you heard, the mask, my mask protects you, your mask protects me. And you have a lot of folks, this is going to happen every time you come into the visit. Then after that, there's a conversation. And in my line of work, where we're talking about giving, chemotherapy to people, we often sometimes want to make sure that, again, folks are not infected. We don't necessarily have to do a test before we administer chemo. We just have to make sure that folks haven't had any symptoms at all. But if there's even a slight doubt, then you have to go for a test. And some places are actually doing this before you do a procedure. So before you go ahead and do a procedure for something or a surgical procedure, you're going to have to get a test as well. I tell you that because I think it's important for folks to know that and know that you're going to see that coming in. And this is the way that hospitals have been very safe. The amount of transmission from institutions, from the hospital to patients has been microscopically low. And I think that's because of the lessons that were learned at the beginning of the pandemic, and also from these strict precautions that were taken. And that's a good thing. So, and that's both ways. So we haven't seen, once we understood that there could be asymptomatic spread, and once we actually were able to utilize all of our PPE, we actually saw very little spread in hospitals once these things were put together. And I just want to reassure folks that it is safe. So after months of us telling you stay home, now then we tell you to come back, it sounds like it's a whiplash. It's not. We actually know the services that we have. We know that we can protect not only our staff, because that's important, right? We want to take care of folks, but also make sure it's safe for you all. The other thing that has been very difficult for our communities, I think, in all this, and the way COVID has restructured this, is the visitation policies. Again, this is for protection, but let's not forget that makes it difficult, right? For sometimes, if usually there is a spokesperson for your family, and whether this is language based or culture based, that's usually accompanying you. Now we're asking folks to wait here or there or not come. As you know, the governor is actually changing that a little bit, and one visitor is allowed. And don't forget that if a person has cognitive issues or physical limitations, usually there are some expectations or exceptions there. That's a time where I actually think, and I'm sure Dr. Westlake has done this too, where you have to get a little creative, whether I call a phone, a family member from the room if they can't be in, put them on FaceTime, figure out a way. There's no excuse to not have your interpreter involved or not have that family member who makes the decision involved. And I think making sure the providers know that. Because, the key here, and in my notes, what I wanted to talk about is, COVID has changed the way we're delivering care, and that's for all providers. And it's changing the way that the care is extending into the community. But that does not mean that it has to extend the already present, very severe disparities that existed for eons. And I think there is worry for most of us that, just because we've changed the way that we deliver care, this should not exacerbate a care gap. And so I think the knowledge of what should be expected so that people don't feel like, why are they asking these questions? That's important. But also for the providers to know that they actually, that we need to be able to make sure we're able to deliver care to folks. Because if folks don't come back and get their screening for colon cancer, they don't have the conversations about prostate health. They don't end up having, any of their usual mammography screenings and all of those things. And we haven't even got to vaccine season yet. If you don't do that, then you're going to actually have worsen things for us. So I'm sure there might be questions later on, but that's really what I wanted to say and what I wanted to focus on. So thank you very much for your time and for your attention.
Dr. Layton, thank you. Outstanding. And, I brag on you anyhow. I'm up in Boston. You're a Springfield native, Glasgow Bulldogs, and, fantastic. And I just want to say outstanding. And what I'm going to say to you right now is that when I get back to the Black and Latino caucus, we need your expertise, you and even Dr. Westland, in terms of Westlake, in terms of educating us so we can educate the greater population. The men of MOCHA do a fantastic job. You hit it out of the park. I really mean that. But I'm going to be leaning on you and folks assembled today, because this is part of, from my perspective, part of the conversation that's not taking place. And when I say that, we do a lot of health policies, but they're written by politicians and not by the health experts. So I'm going to be leaning on you. I want to thank you. You make Springfield look good, man. You and Helen, you guys are the best. Thank you. Also, the next individual is within the 11th Hamden District, and she's over at Bay State Medical Center in the heart of Mason Square, and that's Dr. Amanda Westlake, and she's going to speak to the clinical perspective from the front lines, and she's on the front lines. And I went over there a couple of times, doctor, when you were doing the testing right out in the parking lot. You're testing there. You're testing on 140 High Street, and I made several visits. It was outstanding. You're right on the front line. So we just want to thank you again. You're just doing your job, but you are between them and the virus. So without further ado, Dr. Wesley.
Hi, thank you so much, Representative Williams, and thanks to the men of MOCHA for inviting me here. I am both a primary care doctor at Mason Square Neighborhood Health Center, and I'm also an infectious disease specialist. And since the pandemic started 3 months ago, I've been working in the hospital, working exclusively with COVID-19 patients. And so Lamont Scott invited me to share some of those experiences. One of the things that I was asked to address is, how is the situation now evolving compared to where we were in March? And I think that right now in the healthcare community, there's really a collective shift in our understanding that COVID is a marathon and not a sprint. We are in this for the long game. And I don't mean to say that to be disheartening, because we've already been through a lot of pain and suffering with this virus. But we need to be reality-based and understand that for the next 18 months, maybe the next 2 years, we're going to be living with this virus in some way, shape, or form. The numbers that the commissioner showed us show how effective we've been at surviving this first wave of the pandemic. But I say first wave because I think that the next 18 months are going to show us many more waves. We're in the downslope now, but there are going to be times when this virus heats up, and there are times when things cool down, just as the time that we're in right now, a period of relative calm where we saw the numbers are flat and declining. And while this doesn't mean we're going to be in a perpetual state of lockdown for the next 2 years, that's obviously not sustainable socially, economically, politically, or anything, but it means that we are in a very fluid situation where we need to adapt and be ready for the possibility of waves and relative lockdowns as this virus works its way through our global community over the next couple of years. Certainly, the information that was presented earlier about vaccines and therapies. This is all hopeful, and I think that we all fervently hope for a vaccine, but hope cannot be our number one strategy here. We've got 100 vaccines in development, but each of those vaccines is predicated on a series of ifs. It's kind of like, if the vaccine is protected, if it can be manufactured and widely distributed, if people take it, if people accept it, if the virus doesn't mutate and change in a way that makes the vaccine ineffective. So I think that, if this is the situation that we're in, we need to figure out how to sustain ourselves and our communities for the next year or so. And we need to first have that as a mindset so that it doesn't come as a surprise. And I know that there have been a cacophony of voices in the political realm giving information on COVID, and some of them have been more clear than others, but I think it's really important for our public health leaders, like the commissioner has been doing an amazing job of speaking the truth of the situation as it is. And I think that is the truth that we're living in, that we're with this virus for better or for worse for the long run. So, what does that mean for individuals? Well, one thing it means is that we certainly can't put off medical care that we need until the virus calms down. If you got diabetes and you're sitting there with a wound on your foot and you're thinking, oh, just, let me wait until this blows over and then I'll go to the emergency room and get my antibiotics. No, that you're going to lose that foot. So I think that is one of the things that you're going to jeopardize your health if you are putting off care until things die down. So I think with that major realization that we're in this for the long game, the healthcare system has realized that. And for instance, Bay State, where I work here in Springfield, has made a bunch of contingency strategies. So having learned from the experience of the past several months, they can essentially turn that entire 733-bed hospital into an ICU in the matter of days. Like, they can turn the whole thing around. So if it happens that 6 months from now there is a huge tidal wave of COVID, they can lock down the hospital, turn it into a COVID ICU, and accommodate all the patients that they need to without the healthcare system being overwhelmed. And the same thing for the clinic. Here at the health center, if we start facing another uptick in the COVID cases, we will just go to telehealth and see only people who need to be seen in person for urgent visits. So I think that's really how things have changed since the beginning. We are all learning to be more flexible. And one of the things that has been so fatiguing is the constant change. It's like, well, first they told us this, then they told us this. What do I believe? And I think one of the things, when you hear the experts telling you things that change from one day to the next, you should actually be thankful in that, because if we were still saying the same thing that we'd been saying in March, it would be pure arrogance and truth that we hadn't actually learned anything. So the constant change, be thankful for. It means that your healthcare professionals are learning about this new, never before seen disease at breakneck speed and incorporating that knowledge into their practice. Others have already spoken about some of the steps that clinical facilities are taking to ensure that patients are safe within them. And in the visits that I've had with my primary care patients, I have heard time and time again, I didn't call the ambulance because I would rather die than get COVID. And that strikes fear in my heart. Now, what Dr. Lathan was alluding to in terms of policies of a universal mask policy in the hospital, every healthcare employee in any realm, in any role, wears a mask at work all the time. When we walk into the building, our temperature is checked. And all patients are also asked to mask when they enter any of the health center or the hospital. So that ensures that any of us who may unknowingly have COVID and not know it because we don't have symptoms will not spread it. And the same for all the patients. And you might say to yourself, well, that sounds good, but do you actually know that that's working? And we do because the rate of COVID among healthcare workers at Bay State and in many other hospitals is the same as the rate of COVID among people in the community at large. So that tells you that our work as healthcare workers does not place us at additional risk because of those policies that we've implemented. As Dr. Lathan was saying, we are also at Bay State. If you're coming in for a colonoscopy, you get a COVID test so that you can be appropriate, the people who are doing those tests can wear the appropriate personal protective equipment. And at the height of the surge back in April, every single person coming into the hospital was tested for COVID regardless of their symptoms, just so that we would know that we would have the appropriate strategies in place so that those patients wouldn't infect others. The last thing I wanted to talk about was just kind of what it feels like to be one of these frontline healthcare workers working with COVID. And the first thing I want to say is it is not like those horror show pictures that you saw from Queens. It has never been like that in Western Mass. We have always had excess hospital capacity. Bay State always had tens, if not hundreds, of additional beds waiting to accommodate patients. It was never a situation that you saw on the news of like people being, treated in the parking lot. It was tense at the beginning, but it was never chaos. And I was never scared to go to work. And I am still not scared to go to work. I come into work and I put on my mask and I put on, when I see my COVID patients, I put on my little shield and I put on my N95 respirator and I feel safe and protected. It has been an experience of a lot of camaraderie throughout the healthcare system. I feel like, through this pandemic, so many people, as healthcare workers, we actually have the luxury of being essential workers and going to work because it gives us purpose during this time. And that is a huge relief. And one thing that has struck me personally is just what a lonely disease COVID is, because when you're in the hospital, no one can visit you, and all of your nurses and your nurses' aides and everyone's coming in these Darth Vader outfits, and you can't really see what their faces look like. And I feel like that has been one of the most heartbreaking aspects, because when I go into these patients' rooms, sometimes I just go in there to hang out with them because it's lonely. And, we set up FaceTime with their family members, and I've, spent a lot of time FaceTiming with people's family members, facilitating those interactions between someone who's sick with COVID in the hospital and their family. And that has been a really, just a really powerful experience for me as a healthcare provider, to be part of the emotional network of support for these patients who are otherwise so isolated. So thanks so much for including my voice in this presentation, and I'll turn it back to Representative Williams.
Thank you, Dr. Westlake. We know you're on the front line, and sometimes I see you out there going through the parking lot and going to do your due diligence. But I want to thank this outstanding panel, all-star panel, for the wealth of knowledge and wealth of information in terms of taking me literally from A to Z. We're broadcasting it Facebook Live. We're recording it, and I will use this recording. I'm going to make an appeal before I bring on the next speakers, is that hopefully the next wave, and this is June, maybe we can reconvene in September sometime, this outstanding panel, just to keep abreast and to keep our community engaged and informative. Because like you said, Doctor, that next wave, according to all the experts, Dr. Fauci and all the folks, it's going to come. And we just need to be prepared. And education and is power, and knowledge is power. So we'll talk about that later. I want to thank this outstanding panel one more time. And anything we can do at the state level, please, you should input us all the time, because we really need your expertise. We need your understanding. We need your guidance. We need your leadership in terms of working through this pandemic. And that's it's a marathon, not a sprint. At this time, we have the next two individuals who really don't need any introduction. They're on the front line. Lamont Scott is the coordinator, is the project director, and Al Hubert is the coordinator. And they've been out there pounding the pavement, doing testing, going all over the North End, Mason Square, Indian Orchard, anywhere anybody will listen to them. I've been part of some of their focus groups. They do a tremendous job. And anything we can do to make men of MOCHA that much stronger, we will, because you're on the front line. And they will come in that order. Lamont Scott and Al Hubert would have the last few words, and we're down to about the last 15 minutes. Thank you.
Brother Al, I'm going to give you the opportunity, then I can close it out and send it back to Bud.
Absolutely. Thank you. First of all, I'd like to thank the state rep, Gonzalez, the panel, Bud Williams, Dr. Stern, Dr. Lathan, Helen Colton. You guys are doing a fine job, and definitely bringing information and awareness to our community is so important. MOCHA was developed about 10 years ago. I think it's very important that we talked about diabetes, high blood pressure. Everything was talked about on this panel was excellent. And that's why it's so important about it says health awareness. That's why MOCHA was developed, that we can bring information to African American men and Latino men in our community that your health is important. I always take it like, my analogy is like a car that has a dashboard with a light on it, and it says you get your oil check. You have symptoms in your body at night. When your body has calmed down, there's some type of signal that tells you you need to get checked. Blood work is very important. Everything is in the blood. I know that it says that not everything that is faced can be changed, but nothing can be changed until it's faced. We've been faced with this COVID-19. We've been challenged, and it's very important that we continue to fight this fight. I like what Doctor said, it's not going to be a quick one. We got to fight on a daily basis to bring information and awareness to those who are still sick and suffering. And my final statement is this: alone, we can only do so little. Together, we can do so much. And that's what we are, a unity that comes together to do a lot of great work in this community. That's why MOCHA was developed. It was a group of people who sat around and said, listen, we need to talk about African American and Latino men's health. But I want to say thank you for Dr. Stern for believing in the MOCHA and continue to work with us as we continue to put out information that is important to our community, because our community is in need. Thank you.
Thank you, Brother Al. And I want to thank everyone else on this part of this panel. My name is Lamont Scott. I am the project director of MOCHA Men of Color Health and Awareness. I've been around the MOCHA since the beginning, since when we stood on the steps of the front steps of City Hall. And my mission is to make a difference in my community. I am blessed and pleased, and also I am a cancer survivor. So I know that I have to focus on health and wealth, and not only to myself, but also if I'm going to talk the talk, I have to walk the walk. And that's why I'm always on the front lines, always in my community, talking about our mission of what we need to do to focus on the health disparities in our community. What I like to say is during this COVID-19 pandemic, I like to reach out to the beginning to all the mentors, all the men of MOCHA, and all the community organizations that's been supporting us and also helping us getting the word out, not only pertaining to this pandemic that's been going on, but from our reception that we've got from our community, just being part of the community, to continue to focus on disparities of men, because we know that men are the hardest one, and we really are. We don't go to the doctor as well as we should. So we're educating men. We want men to have longevity. We want them to be a part of this, and also to teach others. Also, this has been a very great conversation about the pandemic, social distancing. It's been talking about being safe, what to do, washing your hands, covering your face, putting on a mask. All these things are important and relevant that we continue to talk to our community. And the more we talk about them, the more people will get it. We know we are in for a long haul. This is a fight that we have to do. We need to do this together. Also, within MOCHA, we've been following with our team all the guidelines of social distancing, And also, we've learned very well how to utilize the Zoom network and social media now to get the word out. This has been also a great piece for MOCHA to understand and utilize moving forward. Seems like we're going to have to use this more and more, and we know more people are on their social network than ever now. But this is a great opportunity for us to keep our community updated with the fight that's ahead of us. Also, we're following the state and federal guidelines with this pandemic. Social distancing, staying safe. MOCHA has been around and was developed, as Brother Al said, for the health and wellness and the health disparities of men of color. And that is our primary purpose. Zoom, Facebook, all the social medias that are connected. And also, we also like to give all our kudos and our love out to all the health centers in our community. Bay State Hospital, we like to say Mason Square Health Center, Caring Health on Main Street. On High Street, we have another community center. All our health centers in the community, we want to say that we are in full support to working throughout our community, and also we appreciate all those helping us getting the word out pertaining to the pandemic. Also, we'd like to also say thank you to all the organizations in our community that's been very close to working with us. I'd love to say the Department of Health and Human Services, the Deborah Hunt Center in Springfield, ran by Richard Johnson, the YMCA, Dexter Johnson, the CEO and president of the YMCA, which we're now back together with again, and all the other community organizations that have gave us the opportunity and also walked through us and also let us do presentations within this facility, such as the Rise for Social Justice, Springfield Partners. There's so many I can name, but we can go on and on. And also I want to appreciate our community for giving us the time and also listening to MOCHA when we come out to the community to share what our mission is to continue to fight for the health disparities in our community of men of color. Okay, not only with this pandemic, but all health disparities that may be going on with us. Not just with men, but we're including the men, the women, and the children in our community. With that being said, I just want to say another thank you to UMass, Dave Buchanan, Jeff Markham, some of the other folks in our community that's just been walking through us with all the support that we need to move forward and preserve our attendance and our focus to our community, to the work that we're doing with MOCHA. And our mission is to save lives and to also the folks on the health disparities. So with that said, I want to thank all the panelists that came and presented a piece to inform our community. And I'm going to turn this over to State Rep Williams. Thank you also State Rep Carlos for taking the time to get in. I know it was a challenge getting to you, but we got you here. It's more than appreciated. Dr. Stern, Dr. Lathan, Amanda, Brother Al, man, this has just been a pleasure, and I'm looking forward to doing this again. Thank you so much. And I must give my my co-host and my technical assistant, Maria. Am I saying your name right?
Maria Nina.
Thank you, Dr. Stern. You know, I'm not great on names, but I want to say thank you so much for giving me the support to get me through this Zoom network. And I've learned so much from you. And we're going to continue this battle and fight. With that, I'm going to turn it over to State Rep Bud Williams again. Thank you.
Thank you, Lamont. And we need to give credit where credit is due. And this was a brainchild of Lamont Scott, who we talked about this. We actually been working on this for months. We didn't do this overnight. It's been a couple of months we've been trying to put it together and working with everyone's schedule. But I think you've said it best. I want to thank all the panelists, all those who shared information to this community and to us. This is a wealth of knowledge. It's the first time. It will not be the last time. I think it's very important and very critical that we continue to address the community and give them education, because they're hearing a lot of noise is around. And, you know, this pandemic really has shed the light and exposed the inequalities in healthcare. We know it's always been the same. Healthcare inequalities have always existed. it's the light have shined, whether it's a food desert, whether it's hypertension, diabetes, obesity. And one of my goals is to, what really bothered me during this pandemic is that a few months ago, before people could get tested, they had to be referred by a primary care doctor. In my district that I represent, and probably in Carlos Gonzalez district, the north end, I'm Mason Square, predominantly Black and Puerto Rican or Latino, is that most of them don't have a primary care doctor. I mean, Commissioner Colton helped me work out some situations when I needed to get people to get tested. That's very critical that we match every individual with a primary care doctor. We have that fantastic facility in the heart of our community, Mason Square Health Center. So that being said, this has been outstanding. I've enjoyed it. Most time on Zoom, by an hour and a half, I'm almost asleep, but I'm wide awake, and the knowledge and information has been really fantastic. And I'm going to replay this tonight. If I get a copy of this, I want to replay this tonight before I go to bed. Lamont, you can have the last word. I think you have about 2 minutes.
Well, I just want to say if there's anything anyone wants to say, thank you, Director, Commissioner Helen Carlton Harris. You know, I love you so much. You've been such a blessing in my life, and everyone else that's on this panel, Dr. Stern. So if there's any last words you'd like to say to our community, showtime. But I want to say thank you to everybody and everybody that's watching it.
If no one else is going to say anything, anyone else?
Is Dr. Stern?
Dr. Stern?
Yes, actually, I want to acknowledge, I really want to acknowledge Thomas Satam, who is not on this panel, but who came up with the idea of virtual town halls to be held across the state. I'm very grateful to him for everything he's done. And of course, I want to acknowledge Marianina Stewart, our millennial, our intern, who provided so much technical support for us and for Lamont. I'm very blessed to have wonderful staff. And I want to finish my thanks. And I would be absolutely amiss if I did not express deep gratitude to Representative Williams and to Representative Gonzalez for years of support for our work in health disparities. And now we are expanding beyond prostate cancer to take on COVID-19. Thank you for the opportunity for us to do that.
Mr. Chairman, you have something to say?
Just want to say thank you. Thank you, Representative Williams. This is, again, like the gentleman mentioned, the new way of communicating with the communities is so important. Zoom, I didn't know what Zoom meant before. I should have bought the stock market on Zoom before the pandemic. I've probably been a millionaire now, but everybody's going through Zoom now. So it's another way of communicating with the public while we address the issues that COVID has put upon our responsibilities to do so by being socially distanced. But we may be distanced, but we are connected in so many different ways, and information is power. And this is a powerful segment of health information that needs to get out, continue to get out to their communities. And thank you to all the medical experts out here, Doctor, and thank you at PaySafe, and thank you for all the work that you guys do. Again, you are the first responders, you are essential workers, and you are our heroes. Thank you very much.
Anyone else on the line?
One last thing, Mason Square Neighborhood Health Center is open. Don't be a stranger.
There you go.
So I'm going to say our MOCHA pledge just before we go. The MOCHA pledge says this: my community is in need of me, is in need of my fatherhood and my brotherhood. I pledge to be present. My presence depends on my health. My community depends on me. I pledge to be healthy in mind, body, and spirit. And I will foster this in my family and carry this in my community. MOCHA. Thank you, guys. Thank you.